Hey, if you have been struggling with anxiety and you're frustrated with the alternatives that your conventionally trained doctor has offered you, stick around through this video because what I want to show you is not only perspective of the way that conventionally trained doctors in their limited approach uh, have what access they have to help your anxiety, but I also want to approach it from a functional perspective. And it is my belief that if you really want to get better, really turn around this condition so you don't have anxiety anymore, you don't have the depression that's often associated with it, and you don't have to take medications, stick through this video. So what is the conventional approach to somebody who has anxiety? Typically it's a 5 or 6 minute doctor's visit. The doc gets out his or her prescriptive pen, and before you know it, you've left the office with a prescription. But ask yourself this question: has this approach made any opportunities at all to address what's been causing this anxiety? What do we have at our disposal? Conventionally trained doctors have anxiolytics. These are anti-anxiety medications, and typically they're in the form of something like Xanax or Ativan or Klonopin. This class of medication unquestionably helps somebody to suppress their anxiety, but it doesn't address any of the causative factors. And what's more is these benzodiazepines are one of the most addictive medications out there. So not only do you become addicted to these drugs, they also become less effective over time. So the anxiety persists, the fatigue and the brain fog that's associated with this class of medications persists, and you're really not getting better. Another option that most conventionally trained doctors have is to prescribe an antidepressant. But are we talking about depression here? No, anxiety is a distinct condition. So let's do this. Let's first address some of the causes that can precipitate anxiety, because when we understand some of the causes of anxiety, then we can take steps to actually rectify them. So what is anxiety? Anxiety, quite simply, is a heightened response of something that might happen. And an important thing to realize as I go over this with you is that oftentimes an individual suffers from anxiety based on the preconceived notion that something is going to happen, not something that is actually happening. So one of the initial things that you'll need to think about as we begin to address what's causing your anxiety is, where do you live? Do you live in the past, thinking about things that have happened in the past? Do you live in the present, recognizing that here we are, we're sitting, I'm making a video, I'm in a safe environment right now? Or are you fretting about the future? Because one of the most fundamental things that can be done to help to stave off an anxiety attack is to recognize that in the here and the now, where you are as you watch this video, is a safe place. And quite commonly, this experience of anxiety actually arises when indeed and again you are in a safe place. So one of the hardest things to recognize is that anxiety is a state of being which is caused by the mind. So let's now take a step back. What are the different factors that in fact influence how it is that our minds work? And what happens is we begin to dissect the different components of our physiology. We can begin to see that there are actionable steps where we can either use diet, nutrition, behaviors, or mind-body practices to help to tamp down this anxious response. And along with that is learn how to exist in the present without feeling a state of anxiety. Are you ready for this? Does that interest you? Okay, great. So let's start at the beginning. If you think about what anxiety is, it's something which is carried through the nervous system, meaning that there has to be an external stimulus, an external force, which our body responds to and then carries a signal to our brains. It's our brain's interpretation of the current state of being that is what drives us into a state of anxiety. So instantly, if we're going to talk about what we can do to fix anxiety, we need to begin to start thinking about how our nerves work. So in basic physiology, what a nerve does is it transmits a signal from one part of the body to another. And it does this by carrying an electrical charge along basically a column of the nerve. And this electrical charge is mandated or driven by two principal ions, and these are sodium and potassium. And because of science that I don't want to get into in this video, what happens is there are a specialized set of pumps that pump these ions against their concentration gradients. So what happens is on the outside of the cell, there's something like 10 times more sodium than there is on the inside of the cell. Conversely, there's about 10 times more potassium on the inside of the cell than there is on the outside cell. And I think I got that right. But the important thing is that when a nervous signal comes through the nerve, these ions, kind of like water breaching a dam, run downhill across their concentration gradient, and then after the signal is passed, they're pumped back out to reestablish this gradient. So the important thing to recognize is that a nervous impulse is an electrochemical signal. So what are the different ways that we can help to modulate this signal? The first is by knowing some of these important ions that are in your body are in correct balance. So I just mentioned sodium and potassium, and we have some very strict processes in our body that keep us from getting really out of balance with sodium or potassium. I mean, if you've got really high or really low sodium, you might have something significant going on, and we're not covering that in this video. There are two other ions that are also important that help to sort of guard these portals through which these ions run and help to neutralize the electrical signals across the cell membranes. And these are calcium and magnesium. Now, it's well known that many people are in a state of magnesium deficiency. And I can tell you that there have been a number of clinical studies that have actually looked at magnesium as a standalone intervention to help to suppress an anxious response. The other thing that you need to think about is your calcium, because calcium also has the property of doing something called gating a channel. And this is the +2 electrical charge of calcium helps to balance out some of these electrical charges so that these nerves aren't firing willy-nilly. And the last ion that's really important to consider when we're talking about anxiety is iron. Now, iron is a more complex ion, and the purpose of this video is not to get into iron handling and metabolism. But just know that somebody who is suffering from either a low iron state, and typically this is associated with a low blood count and oftentimes low blood pressure, there's also a class of people that are suffering from a high amount of iron in the body. And theirs is a condition which is known as hemochromatosis that affects 1% of the population, in which we deposit too much iron in places like our liver and our heart and our brains. And I can tell you that having worked with a number of people that have hemochromatosis, that one of the common clinical findings is one of anxiety. But really think about it. How many of you watching this video, when you've spoken to your doctor, have had your iron checked, much less your magnesium? And one more point along those lines. If you're going to measure your magnesium, be sure to check something called a red blood cell magnesium. This is a reflection of your body's magnesium stores and not a reflection of how much magnesium you had with your breakfast or your morning vitamins. So now we've talked about a couple of nutrients that are, or a couple of ions that are associated with precipitating a state of anxiety. But there are some other nutrients as well that are really important that I want you to consider, one of which is something known as the omega-3 fats. These are the omega-3 fats commonly known as fish oils. And what's interesting is that these polyunsaturated fats are important because they contribute to the membrane structure and flexibility in all of our cells in our body. And what happens is as you consume more of these saturated fats, think like Hershey bars, our cells and our nerve membranes become more rigid. They really don't work quite as well. As we consume more of the polyunsaturated fats, specifically the anti-inflammatory omega-3 fats, we develop membranes which are nice and spongy and pliable and want to work correctly. And in fact, there was a really cool study done on medical students that showed that with higher doses of the omega-3 fats, something like 2.5 grams a day of balanced EPA and DHA, that there was a significant reduction in the presence of anxiety and depression. And the last nutrients that are really important when we're thinking about anxiety are our B vitamins. Why is this? Our B vitamins are really important for the production of a number of different neurotransmitters, namely serotonin. And I can tell you that serotonin is the number one, everything's cool, everything feels good in the world neurotransmitter. So as people become more deficient in B6, B9, and B12, or their ability to modify a molecule known as homocysteine, they develop less production of their serotonin and conceivably have greater anxiety because of this deficiency in a neurotransmitter. So there's another test that you can ask of your doctor to obtain, something known as a homocysteine. This tests functionally how well your B6, B12, and B9 are working. Now, the next thing that we need to address is what is going on in terms of your stress response, because unquestionably anxiety is associated with cortisol and adrenaline. What are these? These are our sympathetic nervous system hormones and neurotransmitters that basically keep us alive. They are the flight or fight neurotransmitters that raise our blood pressure, raise our heart rate, raise our acuity so that we can either fight our way out of a situation, negotiate our way out of a situation, or run like hell. What's interesting is that in my clinical practice, and again, I've measured tons of cortisol studies on individuals, is I see that a lot of people that are suffering from anxiety have one of two things. And this is either a really high cortisol pattern, where over the course of the day they're secreting excess cortisol, or they've got a very low cortisol pattern. What does this do? Cortisol's main job is to regulate our blood sugar. So if we get into a place where we have basically taxed our adrenal glands for too long, we've gotten ourselves into a generalized hypocortisol or low cortisol state over the course of the day, what do we have to raise our blood sugar and raise our blood pressure when we need to face some kind of a challenge? You got it. It's adrenaline. And adrenaline is kind of like the wild child compared to the nice, patient way that cortisol can raise our blood sugar, raise our blood pressure, and help us to navigate some of these challenging situations. So ask yourself, is there a component of your anxiety where you feel like you've been shot out of a cannon? I mean, you go from 0 to 60 in just a breath, from feeling calm to feeling anxious. If that's the case, you might ask yourself what your cortisol status is, and even consider maybe measuring some component of your adrenaline, which is also known as norepinephrine and epinephrine. The next thing that I want you to consider, and again, this is something that your conventionally trained doctor will never even think about, is what's going on in your gut. I mean, there's been so much literature out recently showing that the gut probably has an equivalency or maybe even more neurologic tissue than our brain. And one thing we are learning is that a number of the important calming neurotransmitters are actually made in the gut. So earlier I alluded to serotonin, our everything feels good in the world neurotransmitter. It turns out that some 90% of your serotonin is made in your gut. And how about GABA? GABA is probably the most calming of all of the neurotransmitters, and it turns out there is evidence that there are bacterial species that live in our gut that are actually producing GABA and possibly returning it to our brain through the vagus nerve. But how often in your conventional doctor's office are you even talking about what's going on with your gut? I mean, there's some simple tests that you can do just to see how well your gut is working, and I'll make another video to explain what those are. The next thing that I want you to consider is the presence of toxins. And, it's pretty clear we are awash in a toxic world. I mean, there are millions and millions of human-made molecules, some of which might be okay for our body, most of which probably aren't. But we have detoxification pathways in place where our body is able to identify a molecule, a microbe, or a chemical which is potentially injurious to our body. So we know that there are a number of different environmental toxins that actually raise our degree of anxiousness. And one of the things that you can do is simply look around you and understand what the different exposures you might have to some of these toxins. I mean, are you eating processed food? Do you live in a very polluted city? Is your water clean? There are some really simple interventions that you can begin to ask yourself to understand whether your state of toxic exposure is higher than somebody else. And here's what's important, is that there are any number of different teachers and gurus and plans online that are going to help you to detoxify. Here's what I can tell you right now. You will never fully detoxify your body if you're not nutritionally sound, if you haven't balanced your energetic hormones, which are insulin, cortisol, and thyroid, if you have not addressed what's going on in your gut. Why is this? Because your gut is your number one detoxification organ. And finally, with all this in place, then we can detoxify well. But I can tell you the number one step is to make sure that you're not taking in any additional toxins. And that includes things like alcohol, cigarettes, processed foods, and the list goes on. The next thing that I want you to consider about is your hormonal status. And in men and women, there are different fluctuations in some of the common sex hormones, namely testosterone and estrogen, that can precipitate to a state of anxiety. In women, it's not uncommon as they proceed up through their reproductive years. And I mean in the perimenopause, maybe between ages 40 and 50, when a lot of women, for various reasons not to be covered in this video, but another, get into a state of estrogen dominance. This is a place where typically in the second half of the menstrual cycle, they become dominant in estrogen relative to the calming progesterone that is produced in the second half of the menstrual cycle. The typical symptoms associated with the state of estrogen dominance are weight gain, water retention, but there's also a degree of moodiness, anxiety, changes in sleep, changes in bowel and bladder patterns that typically occur in the second half of the cycle. Typically, this can easily be remedied by taking some steps to bring down your estrogen. And again, this is the point of another video, but also to potentially raise up your progesterone in the second half of the cycle. This is a safe, accessible, and inexpensive intervention. And how about guys? I mean, there's sort of like this cultural myth that when a man has too much testosterone, he gets aggro. He's like angry and wants to fight. That's true when somebody has way too much testosterone, or they've been juicing, or they've been in the gym like using a contaminated or adulterated products. But the truth of the matter is that as a man's stress goes up, as his testosterone tends to get lower, one of the common symptoms that I see with that is a state of anxiety. So these are some simple questions that you can ask yourselves. If you're a woman in her reproductive age, testing your hormones on day like 18 or 20 of your month, starting your counting with day 1 when your period starts, what is your estrogen to progesterone ratio? Because as you get a greater degree of estrogen dominance, you're going to start feeling some more symptoms of anxiety. And guys, you can check your testosterone. I recommend checking a sex hormone binding globulin, total and free testosterone to see how much testosterone is available to your cells. But know that if your testosterone is on the lower side, like in the 25th percentile or lower, this could well be contributing to your state of anxiety. And finally, underpinning all this stuff is this concept of inflammation. And there's so much research out there that shows that as we become more inflamed, all these nerves I talked about earlier become more irritable. They become kind of like a long-tailed cat in a room full of rocking chairs. So what are the different steps that you can do to suppress your inflammation? You can eat better, you can exercise, you can sleep, and you can avoid taking any additional toxins or chemicals into your body when possible. So there we have it. Conventional medicine, where you've got one of two options. You've got an antidepressant or an addictive anti-anxiety medication like Xanax or Ativan, or you can begin to look at your health from a functional perspective and begin to make the measurements, obtain the laboratory testing, and use directed supplementation and nutrients and dietary changes and mind-body practices and little things like exercise and sleep modifications to turn around all these aspects of your health. This is within our grasp, and my mission is to actually help you by creating videos like this to become best stewards of your own healthcare. I think that the future of medicine is in individuals like you and me learning to take care of our own health and driving a healthier lifestyle and not just being dependent on these drug-pushing pharmaceutical companies that are making profit off of your illness. Okay, I hope that was helpful. As always, my name is Scott Resnick. I'm a medical doctor. I'm making these videos because my mission is to empower you guys to be best stewards of your own healthcare and to turn around your health without using drugs when mainstream medicine has failed you. Of course, this is YouTube, so be sure to like, comment, subscribe. Let me know your thoughts. I'll be sure to respond to all of your thoughts personally. And of course, I will see you in an upcoming video. Be well.